What is the most common complaint by your patients?
In my experience, it's definitely patients who come in with low back pain the most frequently.
And who comes in with lower back pain?
Well, who hasn't had some form of low back pain in their life at some point? Anyone who sits at a desk all day, a computer too high, too low, a keyboard inappropriately placed, a mouse that isn't in the right place in function with the arm where it's resting, a chair that's inappropriate or just simply bad, someone who hasn't checked their mattress or their pillow in a long time, new moms, new dads as well, come in with low back pain due to the postures that their spine hasn't been used to. Children who sit at a desk all day or carry backpacks that are too heavy. Adolescents, we know we talk about text neck and text thumb, but that impacts their low back as well because they're sitting to do it. Teenagers who play sports at an age that their spine isn't probably quite ready to handle yet as well. All of these activities can lead to acute or chronic back pain.
What is acute and chronic pain, and how would you describe it?
The best way to do that is to show you this model of the spine and tell you exactly what's happening. I'm pointing to a small spinal joint here in your low back, and it's really no bigger than a nail on your fingers. There are sensors in those joints, and they send messages to the different nerves, to the muscles that overlay the spine, and they tell you that that irritation, whatever it may be, has to stop, okay? And that can happen with a wrong move or lifting that stops you in your tracks, or damage can be done over time with constant pressure, and that is chronic low back pain. Because pain is nature's alarm bell at either stage that is telling you that there's something wrong.
Could you now describe how my lower back functions in relationship to the pain?
Okay. Your spine is meant to function within different ranges of motion normally when everything is working well. When you're sitting at your desk now, you are bringing constant pressure onto the discs which sit between the vertebra. All of these structures have nerves inside of them that relate to that pressure and tell the spine how much it can take. Imagine 30 10-pound bags of potatoes pressing on your spine when you're sitting at your desk, day in and day out. It can only take so much pressure before it starts to not function properly. And when it's had far too much pressure, far too much activity and pressure, it shuts down, it will lock on you, and that transmits a pain signal. And that's when you are in trouble.
What would you suggest?
I certainly suggest that you take your back pain seriously at any age. Doesn't matter what your walk of life is, if you're looking after your child who is complaining of back pain, if you're a new mom or if you're a senior, chiropractic really can help, so please do give us a call.